for our web. Okay, we're recording this, so just so you know, I want to thank you for joining us this evening for the Health Insurance 101 in preparation for the Get Covered New Jersey open enrollment period. My name is Nancy Cohen, and my team is Rebecca Shockett and Daisy Carrera, and we're all certified assisters with the state of New Jersey, and the three of us will be presenting this evening. We hope this evening will be an informative webinar so that you all have a better understanding about the open enrollment process and learn how to access affordable health care. This webinar is made possible by the State Navigator Grant in our partnership with the LRRC, the Lakewood Referral and Resource Center. So I just want to let you know, we are very appreciative of you joining us. And if you have any questions, again, I'm just going to repeat, please put them in the Q&A box down below and the lower part of your screen. And we will try to address all questions at the end of our webinar. This evening, we're going to discuss New Jersey Family Care, also known as Medicaid, the open enrollment period, Get Covered New Jersey, and choosing an insurance plan and the best way to do that. So next slide, New Jersey Family Care. So New Jersey Family Care provides eligible New Jersey residents with free or low-cost health insurance. It covers doctor's visits, prescriptions, vision and dental care, mental health services, and hospitalization. As you can see from our chart, which may be confusing a little bit, if you look in the first row going down, I don't know if you can see my cursor, the first row for a family, back with that, thank you, Daisy. The first row going down, you can see that if you fall below 0 to 138% of the federal poverty level, you may be eligible for this program. If you're a family of 2 or 3 or 4, that's what your monthly earnings could be. Then there's different programs. The Plan First program is really just a program for those people that need that provide free or health, that provides family planning services only. That's the Plan First family planning. The pregnant women is if someone is pregnant, you can see that the eligibility amounts are a little higher. So you may qualify for New Jersey Family Care at a higher eligibility. And the rest of all the pink boxes are called CHIP, or Children's Health Plan Insurance Program. And you may fall under this category, just your children. This is for 19 and over. I'm sorry, under 19 years old. And you may fall under this category, and there are no premiums for this category. Even though it might say some premiums on the bottom, this is a new development with the state. There are no premiums for this category. So there are different levels of eligibility for New Jersey Family Care. And again, you can either call us for more information, or you can go to www.njfamilycare.org for more information about NJ Family Care, also known as Medicaid. Again, it's just a fancy way of saying Medicaid. Next slide. And again, there are no premiums for New Jersey Family Care plans going forward. At this point, we haven't heard anything different. So you will not have to pay anything out of pocket to be eligible for these plans. And children do not need to be uninsured for 3 months before enrolling in New Jersey Family. Slide. So we're going to cover this a little bit more later, but if you're eligible for Get Covered, if you apply for Get Covered New Jersey and they find that you may be eligible for New Jersey Family Care, your application will automatically be sent to the state for evaluation for New Jersey Family Care, and you'll receive a notice in the mail. So don't fear, you'll get some kind of a notice that you're being evaluated for New Jersey Family Care. Also, you need to know that in state of New Jersey, you may incur a penalty if you don't have health care coverage. You need to be covered after 3 months. If you're not covered for health care insurance, you may impose a tax penalty, but that's something we can cover on a one-to-one basis and go over that with you. So now we're going to cover open enrollment. Open enrollment is actually right now, we're in it. It began November 1st and it goes to the end of January 31st, 2022. You can apply for Get Covered New Jersey anytime throughout that time. But if you would like to be effective as of January 1st, you need to apply by December 31st and pay for your first premium before that time in order to be effective January 1st. If you're still unsure, or you have some other coverage, or for whatever reason, back when you missed it, you can still apply in January for a February 1 effective date. And so you have until the end of January 31st to apply for Get Covered New Jersey. And if you, let's say you choose a plan that you're not happy with now in January and you still want to change it, you can change your plan. You have until the end of January to change your plan and change and update your application. And this is the only time of the year that you can buy or switch private health insurance plans through an insurance broker or Get Covered New Jersey. And like I mentioned before, you're required to have health insurance. And if you're uninsured for 3 months or longer, you have to pay a tax unless you qualify for an exemption. So, and again, that's something we can discuss and educate you further if you call us directly. Special enrollment periods. So right now we're in an open enrollment period, but let's say you miss it and now you need healthcare coverage. There are special enrollment periods that you may be qualified to apply. Generally, if you have a dependent in your home who now turned 26 and is no longer going to be on your tax return, they can apply for Get Covered New Jersey. Someone who just became a citizen may be eligible to apply for Get Covered New Jersey. Someone who's pregnant or is going to have a baby may be eligible to apply for Get Covered New Jersey. If you've moved from one state to another, you may be eligible to apply, so changing your location. If you got married, you change in circumstance, now you're married, that is also gives you a special enrollment period. You got out of prison and now you need health insurance coverage, that is a special enrollment. If your income changes, you may be eligible for a special enrollment period. And sometimes if you lose coverage, other healthcare coverage, or you didn't pay your premium, but it was for whatever reason, you may be eligible for a special enrollment period. So there are several reasons why you might be eligible for a special enrollment period. And we can, of course, help you with that and get you enrolled right away and Get Covered New Jersey. If you, whatever month you enroll in, the following first of the month, you would be eligible with your plan. Next. Okay. Hand off to Daisy.
Sorry, everyone, I didn't realize I was muted. So I'm gonna, thanks a lot, Nancy, for covering the basics on NJ Family Care and open enrollment. So what is Get Covered New Jersey? Get Covered New Jersey came as a response as a result of the COVID-19 pandemic. So the state of New Jersey really wanted to make it a statement where they wanted to be able to provide affordable health insurance, quality and affordable health insurance for New Jersey residents. So this was the result. Get Covered New Jersey. It completely replaced Obamacare or the healthcare.gov website. So I'm pretty sure that a lot of you received letters last year, November, that Get Covered New Jersey replaced the healthcare.gov or Obamacare. So getcoverednewjersey.nj.gov is the official health insurance marketplace where you can buy health insurance and also see if you're eligible for financial assistance. So who can qualify for Get Covered New Jersey is any U.S. citizens or you have to have a qualifying immigration status. And there's a various list of that. So if you need more information of what a qualifying immigrant status is, we can definitely give more information at the end of the webinar. There is an extensive list of that information. Another thing to take into consideration of who can purchase a plan to Get Covered New Jersey is that you must live in the United States or have a primary residence in New Jersey. And also for tax purposes, you must be considered a U.S. and New Jersey resident as well. And another requirement is, which nobody here attending will have an issue, is that you cannot be currently incarcerated. So everyone attending this webinar will not have an issue with that last requiring item. So for this year, for Get Covered New Jersey, there are 4 companies that are currently offering plans to Get Covered New Jersey. They are AmeriHealth, Horizon Blue Cross Blue Shield, WellCare, and Oscar. So those are some of the plans that you are going to be able to shop if you decide that to shop their plan through Get Covered New Jersey. So plans available through Get Covered New Jersey are also available through private broker. A plan has exact same coverage no matter where you buy it from. The only difference is if you opt out to buy insurance plan out of Get Covered New Jersey, you won't be eligible for the financial assistance that is available through Get Covered New Jersey. So you may be eligible for financial help. So as a result of the American Rescue Act plan, which came into effect in 2021, it made it possible for Get Covered New Jersey to be able to provide financial assistance through three different financial assistance or subsidies that we're going to be talking about later on in the slide. So again, this was as a result of the American Rescue Act plan that came into place recently, March of 2021. So who is eligible for this financial help is individuals who purchase a plan through Get Covered New Jersey. Like I mentioned before, if you choose to purchase a plan privately with insurance, with a different insurance or not through Get Covered New Jersey, you will not be able to apply or be eligible for those for that financial assistance. Also, if you have a qualifying income, so there is an income, there is a qualifying income in order for you to qualify for financial assistance. So it all depends where you are, what your income level is, the family size. So a lot of things are taken in consideration to see how much you qualify in regards to financial assistance. And we are going to be talking a little bit about that later on during the slides, but income is one of a qualifying criteria to be eligible for financial assistance. If you're not eligible for Medicaid, CHIP, or Medicare, you are qualified. You could be eligible for financial assistance. Again, like Nancy had mentioned, if when you're filling out the application to Get Covered New Jersey, you get flagged that you qualify for Medicaid or NJ Family Care, your application will be automatically sent over to Medicaid and NJ Family Care. You will then receive a notice that that your application is being reviewed. So you will finalize basically your application process through Medicaid and NJ Family Care and not Get Covered New Jersey. Same thing with Medicare. If you are over the age of 65 and you qualify, and you have the credits to qualify for Medicare, you will not be able to apply through coverage through Get Covered New Jersey. There are some exceptions. They're very, but we can definitely go over that more extent after the webinar or give you resources. So if you're here attending this webinar and you had questions or you qualify for Medicare, we can definitely address those questions probably on a one-on-one or after the webinar. We can give you some resources. And the last item is you're not offered affordable, adequate job-based coverage. So Rebecca is going to talk a little bit about that because it is an important criteria to see if you qualify for financial assistance.
Hi, everybody. Thank you for coming. Okay, so what does affordable and adequate coverage mean? So if your employer offers an insurance plan that's adequate and affordable, you're not eligible for financial assistance. Okay, so what does that mean? Adequate means that your employer coverage must cover the minimum essential coverage. We're going to discuss what those are in a later slide, but there are 10 basic essential parts to a coverage. Preventive care, pregnancy health, like those type of things. 10 essential things that if your employee-based coverage does not cover that, then you have like a stance to come to Get Covered and say, hi, my employer does not have adequate coverage. So then I want to come to you to be able to get covered, to be able to get insurance. Now, what does affordable mean? Again, that's a very subjective word, affordable. So affordable means that the plan that your job is offering you is 9.61%, more than 9.61% of your total gross household income. So let's look at this example on the screen. So we're giving an example of a household size income of $40,000 a year. On the left-hand side, the employee is going to get covered. So their insurance, the job is charging him $150 a month. Well, that's only 4.5% of the income. Okay, so that's considered affordable. But if you look on the right where it's employee and family coverage, they're going to be charging the employee or you $450 a month. Well, that's 13.5% of the income. Well, that's not considered affordable. So this affordable is very subjective, and it's a lot of math. We're very happy to sit with you and to help you figure out if your employee-based coverage is affordable, and so be able to determine if you'd be eligible for coverage from Get Covered. Next slide.
So projecting income. So again, a really important piece when considering if you want to accept the financial assistance being provided by Get Covered New Jersey is your income. So so the amount of financial help you are eligible for depends on how much income you expect to make in the year of coverage. So unlike NJ Family Care, which doesn't ask you to project your it's not based on a annual. Sorry. So again, so Get Covered New Jersey asks for you to predict your annual income. So it takes into consideration how much you're going to make for the entire year, even though that year still hasn't happened. I know it's very weird, but they ask you to predict or estimate your income based on what you think you're going to make for that year. So income is counted for you, your spouse, and everyone you will claim as a tax dependent. So when you file your taxes, anyone who is included on your taxes, if you have your son or daughter who's over the age of 21 and they're working, you do have to count the income when you're doing your application. So that is taken in consideration. If your income is hard to predict, like I said, Get Covered New Jersey asks for you to predict your annual income. It's really, if that's difficult for various reasons. I mean, we saw this throughout the pandemic. A lot of people lost their jobs or worked only half a year, and they were still asked to project what they're going to make for that annual, for the year. So the best thing that we can say is to base your estimate on your past experience or recent trends. So really to do your best to make a realistic estimate. If your income changes during the year, you are required to update it for two reasons. One of them is that if for whatever reason there is a cut in wage or loss of income, if you can, by updating this information into the system, you can qualify for more financial assistance. On the opposite side, if you have a severe increase in your salary and you don't report it at the end of the year when you report your taxes, that could be a challenge, meaning that there is a possibility that you will have to pay back money in regards to the financial. If you accepted financial assistance and in reality you should have received lower. So it's really important to predict as close as an estimate to what you think you're going to make for the year when accepting the financial assistance. So choosing an insurance plan. So something to really take in consideration in regards to insurance plans, to really see what your health needs are, what your family's health needs are when choosing an insurance plan. And these are some of the basic elements an insurance plan will have. So Rebecca started mentioning that that all Get Covered New Jersey plans must cover minimal essential coverage. And what that means is that as a result of the Affordable Care Act, which came into place in 2010, all insurance have to provide what is considered minimal essential coverage. And these are 10 specific services that you will see in all your plans to Get Covered New Jersey, because Get Covered New Jersey must provide these minimal essential coverage, which are include doctor services, inpatient and outpatient hospital care, prescription drug coverage, pregnancy and childbirth, mental health services, and more. And the reason why we say that that this is really important, Rebecca started mentioning when she mentioned that this are, if you don't have coverage within 3 months that provide the minimal essential coverage, you will be penalized. So if you have an insurance plan through your employer or through a private insurance and they don't meet the requirements of the minimal essential coverage of the services that I've mentioned, you will be penalized, and you will have to pay back probably when you file your taxes. Preventative care is included in all the insurance plans to get covered in New Jersey. That's also made possible as a result of the Affordable Care Act. So preventative care is a list of services that you can access at no cost, which includes, I'll just name a few because there's a list of them, like colonoscopy, 1-year exam, your mammogram, some dental, basic dental and vision, what is considered your routine exam. So if at any point you are accessing preventative care, anything, there is any findings or you need follow-up or MRIs, that will not be considered preventative care, and you will have to pay for those services based on what your plan dictates in regards to co-insurance or co-payments. And we'll go a little bit more into detail later on in the slides. So provider network. So a provider network is basically a list of doctors, healthcare providers and hospitals that a plan has contracted with to provide medical care to its members. So most of the plans that are available now through Get Coverage New Jersey, they do not provide coverage outside its network or out of state coverage, but there are a couple of plans in gold, particularly with the gold plans, that you are going to be allowed that flexibility, particularly with the out of state coverage. But we'll definitely we'll go more into detail after the webinar for individuals who are interested in those type of plans. Sorry. So pre-existing conditions. So similar, again, because of the Affordable Care Act, past illnesses, injuries, your gender will not affect your ability to get coverage or what you pay for your monthly premium. What is taken in consideration is age and family size. I'm sorry, yes, age and family size. So that is taken in consideration on the plan that are available to you, and also the amount that you are going to pay for specific insurance plans. So age and family size are taken in consideration, but your pre-existing conditions will not be taken in consideration. And that takes us to Rebecca.
Me. Thank you, Daisy.
Sorry, Nancy.
Nancy, I'm gonna take the next couple of slides. So now we're going to talk about premium versus cost sharing charges. Your premium is basically your monthly cost, what you pay for your health plan, and your cost sharing charges are covered by your insurance that you pay out of pocket. This generally includes deductibles, co-insurance, and co-payments, but not premiums. And I'll talk more about that on the next slide. So what is a deductible? Deductible is basically what you need to pay before you can really access your health insurance. Except for certain preventative care and annual visits, which are not part of the deductible, you need to meet your deductible in order to access the benefits of your health insurance. A co-payment is a fixed dollar amount for an item or service that enrollees must pay, meaning if you see a specialist or a primary care physician and the co-payment is $30, it's going to be $30 every time you go to the doctor once you meet your deductible. So it's a fixed amount. A co-insurance is a percentage of the cost of an item. So some insurance plans have a percentage when you get lab work done or an x-ray or something like that, and it's 10% of the cost. So if the cost is $100 and you have to pay 10%, you'd be paying $10 for that service. So that's what a co-insurance is. And all these add up to your part of your cost sharing, and all these add up to your deductible. Next. So out-of-pocket maximum. So this is the maximum that anyone will pay out of pocket for an individual and for a family. So there is a cap on what you have to pay, no matter how much medical care you need. This is set on a yearly basis. And for an individual, This is $8,700, which is the most anyone will ever have to pay out of pocket. And for a family is $17,400, that the most that anyone will have to pay out of pocket. So can you go back, please, Daisy? Thank you. So each plan is a little bit different and they have different out-of-pocket maximums, but this is the overall maximum that anyone will have to pay. So hopefully you'll never have to reach these amounts, but this is the most you will ever have to pay out of pocket. Now move on. So for instance, here's a cost sharing example. You have a health plan. I think Rebecca, you were gonna
Right.
discuss this.
Okay, so this is, if you look at the slide, it's actually showing like a continuum of time. So if we start off in January, so John has a deductible of $5,500. That starts brand new January 1st. Great. He starts paying his deductible, and sometime in March, April, he reaches his deductible. He spends $5,500 in health, and not including Daisy, we see your not including the premiums. The premiums you have to pay no matter what. So those don't go with your deductible. So he spent $5,500 go back to the previous slide. He spent $5,500 on his deductible. So he met that somewhere between March, April. Now what happens? Okay, so he met his deductible. Now he starts to pay any money that he's going to put is going to go towards his out-of-pocket max. So he spent more money and more money and more money. And come September, he met his out-of-pocket max of $8,700. That means that until that point, he's met his deductible, and all his co-pays and all his co-insurances have equaled up to $8,700. After September, or at some point in September, the only thing he has to pay for coverage for the rest of the year is his monthly premium. He is not paying any more money for his co-pays, towards deductibles, towards premiums. I mean, he has to pay his premium, I'm sorry. Nothing else. He is done. So again, he had to pay $8,700 for a single person. So like, that's obviously a lot of money. But once he met his out-of-pocket limit, he only has to pay his monthly premium. Okay, next slide, please. So let's discuss the Get Covered plans. Get Covered New Jersey divides the plans into three categories: bronze, silver, and gold. The way that I like to describe the relationship between the relation between the premiums and the deductibles, it's as an inverse relationship. So let's look at a bronze plan, for example. The bronze plan has the lowest monthly premiums, but again, inverse relationship. It has the highest costs. It has the highest premiums. And as we go up in silver and up to gold, it's going to have more and more, it's going to have the opposite inverse. So the silver is going to have a little bit more of a monthly premium, but again, inverse, the deductibles are going to be lower. The gold plan is the most expensive premiums, but again, the lowest deductibles. So when we meet with our clients, we try to help you understand. I'm going to discuss this further. Just because something might cost more, it may be better for your healthcare. So again, it's hard to predict at the beginning of the year what your healthcare needs are going to be for the whole next year. But just because something might be more expensive, it might be better for your health situation. Next slide, please. Okay, so as we said earlier, anyone can purchase a plan and get covered, but as I discussed earlier, only some people will actually qualify for financial help, which we said before, adequate and affordable and not being afforded from your employer. If you receive financial help, you must file taxes at the end of the year. You cannot be a dependent in someone else's tax returns. And if you are married, you must file taxes jointly. So let's say you are married, but you want to file separate. You are not going to be eligible for any financial assistance. That is a question that they ask. So keep that in mind when you're doing the application, that you need to be able to say and file your taxes jointly. Daisy make reference to this, that a premium tax credits are reconciled from your tax returns and cost sharing reductions are not reconciled. Basically, when you file your taxes at the end of the year, they're going to provide you with the form 1095A, and it basically reconciles what your income actually was at the end of the year. So what Daisy was talking about earlier, about making sure that Get Covered gets notified within a month's time of any changes to your income, they're going to notice if that you did not know, if you did not update them regarding any change in income, they're going to find out if there was a change on the 1095A. So that's why it's very, very important that you update Get Covered New Jersey. Either way, either if there's an increase or a decrease in salary within 30 days. And you actually, when you finish the application, you actually have to acknowledge, they make you acknowledge, you check off a box that you will inform them about any changes to your family size, job, whatever, within 30 days. So it's very, very important. And we're here to help you decide, to determine if whatever change you have warrants you to contact them. Okay, so financial help. What is a financial help? I keep saying financial help. So when you do an application for Get Covered New Jersey, you actually get screens for 3 types of financial assistance. One is an advanced premium tax credit. It's just a fancy way of saying that the federal government is giving a discount to your monthly premiums. The New Jersey Savings Plan, fancy way of saying that the state's giving you a discount to your monthly premiums. They actually, because the state left the federal marketplace, they were to create this whole Get Covered forum. That's why they did it, to be able to give an added layer of discount to us, New Jersey people. And cost sharing reduction, in addition to the 2 previous discounts, this actually goes into the actual plan and lowers your deductibles and lowers your premium, your deductible, co-insurance, and co-pays. So it's depending on your income. Could be very, very, very affordable. The catch is you have to pick a silver plan. Now, if we were to have, if anybody was to come up, you would see that, oh my God, it's saying you have to buy a silver plan. But because of the cost sharing reduction, sometimes the cost of a silver plan could actually be cheaper than a bronze plan. It just depends on how the savings work. We're not trained to predict what those savings will be, but we could help you fill out the application. Next slide. So on the Get Covered website, they have this predictability tool where you could put in, which we're about to do together, 3 identifying informations to be able to see, without doing a full-fledged application, you're able to predict what kind of financial discount you'd be eligible for. So on the previous slide, it had the link to the actual. This is the actual link, which we could provide you guys if you want to contact us, or we could send it to you. It's for the actual tool. Next slide. Okay, so here we go. So make sure, the first thing they're going to ask you is make sure that you pick 2022, because in theory, somebody could come to Get Covered for coverage for 2021. So if you are looking for 2021 coverage, pick 2021. But if you're looking for coverage for open enrollment for 2022, just make sure with the drop down that you actually pick 2022. The next thing is you have to put in your zip code. There are certain plans that are only offered in certain counties. So they have to know where you live. Next one. So here you go. The next thing you have to put into the tool is everybody in your household. Make sure you include every member of your household who is on your taxes, even if they do not need insurance coverage from Get Covered. Let's say your children are on Medicaid, and you don't want them to get insurance through Get Covered. That's fine, but you still have to include them on the application. If your children are covered under any other insurance, you would just uncheck the box where it says seeking coverage, and that's fine. They don't have to be. And then for the bottom, you have to give your best estimate for your 2022 taxable income. Like we stated earlier, it's challenging, but this is something that they need to just base the predictive discounts on. Next slide. Okay, so what is this couple eligible for? So based on the information that we provided previously, it was 2 parents and 4 children living in 07055, and they're predicting their income to be $100,000. So what type of discounts are they going to be eligible for? So here we go. The parents are going to be eligible for advanced premium tax credit. Again, fancy way of saying the federal government's giving you money off. So that's $425. And then the New Jersey Savings Plan is giving $200 off. These are all monthly fees. But guess what happened with the kids? The Get Covered system picked up that the children are eligible for New Jersey Family Care and will forward the application to them, like Nancy had said earlier. So and you'll get something in the mail saying, hi, we got a letter that you'll get a letter in the mail saying, hi, we got an application for you through Get Covered, through NJ Family Care. We'll be in touch with you. But this is just a tool. It's not the actual application, but the point of what we're trying to show is that the New Jersey Family Care and the Get Covered New Jersey system do talk. So it's just because you can't be on both. If you're eligible for NJ Family Care, you can't be on Get Covered. If you're eligible for Get Covered, you can't be on NJ Family Care. It's either or. Okay, next. So now we're going to look at the actual plans. So for example, we said that this couple was eligible for $625 off every month. So the bronze plan is $157.28. Notice that the bronze plan is the cheapest, but again, look at that deductible. It's $1,200. Let's look at the middle, 12,000, right? The middle or the right insurance are silver. So they're going to be more expensive, but look, the deductible is lower. You could go to the next slide. Okay, points to consider when choosing a plan. So the first thing, like I think Nancy had mentioned, that you could change your plan during the month of January for coverage to start February 1st. So if for some reason you make a decision before December 31st and January 1st comes and you realize, oh man, I made a big decision, I made a big mistake, you could change the plan because it's still considered open enrollment. So when I meet with clients and I'm helping them figure out how to decide which plan, silver, bronze, this, that, I try to tell them to take into consideration how you use your health insurance. Are you somebody that needs a lot of medical care? Are you expecting a big medical expense, either a baby or a surgery this coming year? Well, if that's the case, going with a silver plan might be more advisable because the goal is to get the insurance to kick in sooner. And by the way, if there are two adults on a plan who are on the same application, you don't have to be in the same plan. So let's say you know that the husband is going to have surgery and it's advisable for him to be on a silver plan. But the wife says, I never go to the doctor. I'm healthy. I don't need to pay for a silver plan. She could be on a bronze plan, and that's okay. The system allows different people to be on different plans. And that's another way of saving money. Or do you want to have a lower set of expenses, meaning you want your monthly premiums to be lower with the bronze plan, and then you pay for medical expenses as you use your health insurance throughout the year. And that might be better for your budget to have a bronze plan. There's no one answer for everybody. And we try to be able to help our clients to understand what system or what insurance plan works best for them. Okay, next slide. Okay, so this is just going to break down of what we said tonight. If you think you might be eligible for Get Covered, for NJ Family Care, contact us here at our phone number or email us, or you could go to the njfamilycare.org website as stated earlier. If you're not eligible for NJ Family Care, but are offered affordable insurance through your employer, you will not be eligible for financial help through Get Covered, but you can see the full prices on the Get Covered website. If you're not eligible for NJ Family Care and are not receiving affordable insurance through your employer, you might be eligible for financial help. So you could contact us. You could go to the Get Covered website. Any way of communicating, we're here for you. Next slide. And then here is our email address, Get Covered gcnj@jfsclifton. You could call or text us at 973-250-6665. And now we got a few questions when people signed up. So somebody had asked us about United, they're like the Refuah health savings. So we're not going to discuss that here. Just it's not the forum, but you could contact them directly, or you could contact us and we'll discuss it with you, but we're not going to discuss it right here. Some people, we got a few questions about Medicare. So as Nancy had said earlier, Medicare, this webinar is really more towards Get Covered New Jersey and NJ Family Care. If you have any questions about Medicare, feel free to reach us privately and we'll assist you. There was another question about out-of-state and out-of-network coverage. So as stated earlier, I think Daisy mentioned that the gold plans have again, you're paying out the highest premium for them. They will have some possibly out-of-state. With Horizon Blue Cross Blue Shield has a few gold plans, and they do have some out-of-state, and out-of-network coverage. Also, new to Get Covered for 2022 is that they are they added a fourth insurance plan called WellCare. So WellCare, if you sign up through their insurance, through they get covered, they will allow you to see out of state providers within the WellCare network. So if you go to California, not actually specifically not California, if you go to Pennsylvania and there's a WellCare doctor, you could see that person, you could see that doctor under WellCare. They said, we actually had a meeting with them. They told us not every single county in every single state, but they do have a pretty good network. So if you need to go see a specialist who takes WellCare, not WellCare from NJ Family Care, let's not be confusing, specifically this WellCare plan, then you're eligible for, you would be eligible for coverage outside of the state.
Yeah, and it's important to note, in addition to that, that when you're going through the application process on Get Covered, you can go through the details of all the different plans and their provider networks. So you can see if your doctor is there. You can even input the name of your doctor that you want to see and make sure that they're on your plan. So that's just an added bonus, but you want to check the provider network first, especially if you're looking for any kind of out of area coverage.
In general, we always recommend that you call if you're picking a new insurance, that you call the doctor to make sure that that doctor takes whatever insurance you're exploring, and not just relying on the website, because sometimes the websites are not always so up to date. So, when you're looking for a new insurance, you want to call your pediatrician, your whatever doctor that you want, to make sure that they would be the most up to date with which insurance companies are in network.
Okay. I actually wanted to add something. This actually wasn't part of the questions, but I wanted to point out, if you've noticed, when we discussed about minimal essential coverage and insurance plans, we did not discuss about dental and vision plans. So if you want a dental and vision services, you will have to purchase a separate dental and vision plan. So again, most insurance plans will only cover the preventive, with very minimal coverage, which is basically will cover just your annual eye exam or just routine cleaning. If you want anything more services, you will have to purchase a dental and vision plan. This is not the same for NJ Family Care, but it is true for Get Covered New Jersey.
But children are eligible for some tax credits for the dental plan. The adults are not.
Also, you could buy dental. The Get Covered New Jersey platform does sell dental plans for adults also. Contact us to discuss how the discounts work. It's a little bit complicating, and we're not going to discuss it here, but if you are in need of a dental plan, feel free to contact us and we could help you analyze the plans and everything on the Get Covered website.
And the good thing is they're not going to be as expensive as the insurance plan.
But on the other hand, you do get what you pay for. So there are some very cheap dental plans, but just recognize that they really don't cover much. So again, preventive care, anything more extensive, they're not going to cover.
All right, I don't see any questions in the Q&A or the chat. So again, we have our contact information. I'll put it up again, just in case you want to, let me just share screen. If you would like to take down our contact information, and I'm pretty sure in our registration link and where you saw our this event, it also has our information there as well. So I'm just going to share my screen. And again,
if you have more complex issues, please feel free to reach out to us directly. We're happy to answer any questions. Again, don't forget, open enrollment is through January 31st. If you need coverage by December 1st, you can apply anytime this month for coverage. If you need coverage for the 1st of January, you need to apply by December 31st.
And pay.
And the same for February 1. So don't miss out.
Thanks a lot, everyone, for joining us today.
Thank you, everyone.
Have a good night.